Some mental health conditions have become cultural buzzwords like anxiety and depression, while others have set the stage for blockbuster movies like the 2016 film Split. And though public awareness of mental illness has increased, can the same be said for public understanding? Annie Slees is the co-founder and CEO of the Mental Health Literacy Collaborative, a national nonprofit organization. She believes education needs to be a foundational component of any mental health initiative, especially in schools. Though she's now a leader in this movement, there was a time when Slees was a parent, unaware of how much she needed this knowledge in her own life.
I was teaching 90 students a year and directing 2 musicals a year every year, and continued to do that while my child's condition deteriorated. And within a couple of years, I was navigating the prison system as a direct result of my child's unmet mental health needs turning into substance misuse and being in the wrong place at the wrong time.
In 2010, Slees was navigating how to be a teacher and primary caregiver to her 2 children, while dealing with what she thought was the typical teenage rough patch with her oldest, who'd just graduated high school.
My child had a strong social connection and suddenly didn't really want to go see friends anymore. My child loved to shoot baskets, didn't want to do that anymore. Also, sleep was really kind of unusual, might be up really, really late or sleep all throughout the next day, which I know some of that is teenageness, right? But this was getting a little bit more extreme, kind of up all night repeatedly to the point where I was thinking, don't you need sleep? That kind of thing.
Looking back now, there were so many signs Slees can see clear as day, but before she had any real understanding of mental illness, she dismissed even the stranger ones as personality quirks they'd grow out of.
What I think I should have recognized, and had I had training, I would have known, was my child was fearful. I found butter knives in the couch, and I would ask, what happened here? Was someone buttering a bagel in the living room, right? And that wasn't it. It was, oh no, that's mine, Mom. It's for me to feel safer. And I thought, what do you mean safer? We have a house, we're locking the doors, we have security, what's going on? And what I didn't realize was my child was feeling paranoia. My child was feeling signs of unsettled, being able to discern reality from things that weren't real. So that fear manifested itself in bringing a butter knife around.
By the time Slees realized that her child was experiencing a mental illness, they were 18 and able to fight against the inpatient program she requested. Instead, they compromised on an outpatient treatment.
I was like, wait, I'm the mom. And they were like, yeah, but your child's 18. So your child decided that that's not going to work. So this is what we're going to do. When we did that, it was in that facility as an outpatient that my child accessed a firearm, got it from another person receiving care during a parking lot smoke break, just going outside, getting fresh air and buying a firearm out of the trunk of someone's car. My child brought it home, and then my 13-year-old found it.
Slees still had no idea what was going on, but as her oldest grew more distressed over the passing weeks, Slees' 13-year-old finally gave up the secret that there was a gun in the house. Thankfully, no one was harmed, but it was the first wake-up call that alerted Slees to the fact that this was much bigger than anything she'd been taught about mental health. Maybe it was because of this lack of knowledge or fear of what would happen to her family if she shared what was going on inside their house, but it still took a couple more years for Slees to act.
So I was trying to manage this distress internally, quietly, and obviously deeply stigmatized. So 2 years go by, and the thing that made me actually do something was the tragedy at Sandy Hook Elementary. When that happened, my eyes were just opened, and I was like, oh my gosh, there is so much parallel between what happened and what was going on in my house. Now, there are great differences too. The perpetrator in that incident had a very different sort of set of circumstances, but the mother, I definitely connected and could relate to. The mother was said to have been fearful, and I was fearful at that point.
She started building a community through a blog. And though it was making an impact, Slees realized the hypocrisy of her fight to normalize mental health issues while hiding from her own story.
It was anonymous. I was talking all about the stigma of mental health, yet not willing to tell anybody my name or what I did or where I lived because deeply stigmatized I was. But over time, I got a lot of people reaching out from all over the world saying, this sounds a whole lot like someone I know, or this sounds like my story, or my family went through something like this. And as that happened, it just built and built and built. And I realized that there was work to be done and maybe I could help do it.
She started by helping Sandy Hook Promise roll out their Know the Signs school programs in 2016. Soon after, Sleece decided to go all in. She quit her job teaching and became the Director of Advocacy and Education at the National Alliance on Mental Illness in Delaware.
My role at NAMI allowed me to, first of all, learn all the facts I didn't know and share them with parents like me, with individuals like my child, with community leaders, and then to advocate for policies that would make lives better. And when I did that, that's really what brought me to what I'm doing now. Because doing that policy piece allowed me to recognize the influence that policy can have, the positive work that can be done, but also the gaps. And what my work does now is address one of those gaps,
which is mental health literacy. Understanding what mental illness is and being able to recognize the signs in yourself and others. More than 30 states have some sort of mental health education policy in place, but Sleece says there's no universal framework for what should be taught. On top of that, it's hard for teachers to follow a policy and explain something that they themselves don't truly understand.
Just like me, having been a teacher my whole career and not being able to help my own child, most educators don't get this information. Most educators aren't trained in this. So whether or not you have a policy in place that requires something, or you just have people who want to do it, you still need to have the background, the foundation, the confidence around this topic that's needed to provide the information thoughtfully.
The gap between policy and action is what the Mental Health Literacy Collaborative is helping to close.
We're trying to elevate this framework that has been in existence for decades, but we're trying to elevate it as a potential roadmap for school education systems to implement mental health education universally. And doing that with that framework allows people to understand kind of 4 big ideas and to make those ideas suitable for the audience. It's understanding how to foster and maintain positive mental health, understanding common disorders and their treatments, understanding how to seek help effectively, and understanding stigma and how to reduce it.
Sleece believes that just simply being aware of a few statistics can make a huge difference. In fact, she thinks that if she knew nearly half of all lifetime mental disorders begin by the age of 14, she would have reacted much differently to her child's odd behaviors early on.
That fact alone, I think, would have changed the trajectory of my child's life if I had known that raising my child. Because I think I would have recognized far sooner. Because looking back, there were signs way earlier than age of 18. But I would have also pushed back on discussions with physicians when I was asked, or with therapists, because there was therapy on and off throughout my child's growing up. But every time I would say, I think it's more than this, I think this is going on, I would be told, we're in the normal range. This is all fine. Mom, this is fine. Everything's fine, Mom. I would be called Mom, which was very annoying to me. But also, I was sort of put in my place, and I didn't know that I could be the expert of my child. I thought they're the expert. They have the MD degree. I should just sit down and be quiet. And so one of my biggest lessons, I think, is to remind people that you're the expert of your child. You know. And if you don't feel like this particular diagnosis or this particular treatment plan or this particular situation is right, speak up. And if they're not listening, speak to somebody else.
Sleece says mental health literacy isn't just for parents and teachers to notice and understand. She believes it can and should be taught to kids of all ages. The messaging may change when talking to a 3rd grader versus a high schooler, but the outcome is the same: understanding the brain, emotions, and overall health.
Let's hope that by the age of, 9 and 10, we have young people who understand that health conditions happen in all parts of our body. Sometimes we get sick and it's our heart that's sick. Sometimes we get sick, it's our stomach that's sick. Sometimes we get sick, it's our brain that's sick. That's the idea of mental health literacy, is it's just a piece of health literacy, something that young people and people of all ages have been building. We understand really common things, like no one shies away from a broken bone. If you have a broken arm, people don't go, oh no, I can't talk about that. Don't tell me about that broken bone. We have a general idea of what happens with a broken bone. We also understand, because we understand the treatment, We understand that after you wear that cast for a little while, that cast is going to come off and your arm's going to look kind of like it did before, and it's going to be okay. That's our health literacy in action. What we're trying to do is add the piece of health literacy that's been missing, mental health literacy, and young people can learn it.
One argument that pushes back against including mental health literacy in school is the idea that teachers aren't qualified to be speaking about the brain. And though it's true they're usually not neurologists, Sleece says that with the right tools and resources, they can confidently and accurately teach a foundational understanding of mental health that can be extremely impactful.
If you think about it, we have educators who can talk about a broken bone, right? We have science teachers maybe who might be talking about how the bones in the body work. That doesn't mean that they're orthopedic surgeons who are going to operate on someone's broken bone in the recess yard. But they can talk about it. It's the same idea. Mental health literacy is just the education around something, this topic of mental health.
You can find more information about the Mental Health Literacy Collaborative, Annie Sleece, and all of our guests on our website, radiohealthjournal.org. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.